Thank you. So one thing that's come to my attention recently in a study that I've been doing of health and safety inspectors who go around the province and inspect building sites and things like that is the impact of gender on what kind of job gets done. And so they're looking at exposures. And our particular interest is insecure employment, temporary agency workers, and those sorts of things that are relationship issues or employment conditions issues. And so we thought, well, what do inspectors have to say about this? They're on the front lines. They're going out all over the province. Let's hear from them. And, well, it's not within their lens. It's not within their view. It's awkward for them. And it makes you think about any other profession that's gendered, nursing, the other professions, and what consequences there are for the treatment and for the job that they do because of that. And I wondered if any of you had any thoughts on that topic in the course of your research.
Do I have to ever go at this again?
I haven't looked at health inspectors, but the whole issue about precarious employment and concerns about the quality of employment and employer-employee contracts, I think is kind of a broader economic and labor issue. So there has been research, some of it done here at McMaster, that has looked at the fact that precarious workers are more likely to experience health consequences and are less likely to have access to employer-provided benefits. So there are real concerns about the extent to which people not only are experiencing difficulties in terms of exposure to contaminants or other conditions, but whether or not they have access to health care benefits, even within the Canadian system, that are important to pay for medications and rehabilitation and the other things. I think it's an issue.
We do know from the literature that a big predictor of whether people go back to work or not is that relationship with the supervisor, that frontline relationship. So relationships are a really important thing, difficult to evaluate, and particularly difficult if the supervisor is the one evaluating the relationship. There is also some studies I've read, and Peter may have some additional comments to that sometimes the relationship issues are different based on gender as well, so that issues around control may cause more stress for men, and issues around not having a good relationship with your coworkers can cause more stress in women. So even the nature of which types of parts of relationship issues at work seem to also have some gender effects as well.
So, Ellen, I guess what I just in terms of if I understand the question correctly, you were sort of talking about whether there's sort of an acceptance of certain conditions for people of a certain gender, or, I mean, in terms of, because I do think you certainly see around precarious work, for example, that if and I even said just on a societal level, that if you were to meet a couple and the husband was to say, I'm currently I'm in temporary work or I'm unemployed, you'd probably go, oh, that's a bit strange. But if the female partner was to say, yeah, I'm currently just temping, I'm just going, it's sort of like, oh, okay, well, I guess you do that. So I think there is certainly that issue that there's a certain acceptance of certain labour market conditions and even certain health outcomes in relation to gender. So, for example, when women present with comorbid mental health conditions, that's somehow seen as, well, that's just part of the process. If a man presents with depression, it's sort of seen, I think it's treated very differently. And so I think we do certainly have those stereotypes about, well, what is normal for women and men, and it is different in terms of the labour market, and what are normal health outcomes for men and women. I think that is certainly, I think we have perceptions that are probably misperceptions about, what normal should be.
So thank you very much. It's stimulated some thinking on my part. One of the things that I have found since starting to do kind of research and work and health and gender is the importance of providing practical examples or concrete examples to partner organizations, so the non-research crowd. And I'm wondering, I'm hoping collectively across your experiences, if you've got concrete examples of where gender or sex has been incorporated into practice, into a policy, into an intervention, into a regulation that demonstrates why that matters or how that's been effective. I know it's maybe early days, we're still demonstrating the differences, but across your experiences, if you have concrete examples of where that's been incorporated, where there are differences and how to address it, that would be helpful to me.
I don't, actually. I've never seen, not that every company's, required to submit their company policy to one board that reads them all. So we actually don't have access to a lot of the stuff that individual companies may be doing, but I've never come across anything specific.
Your own prevention kind of activities or communications not there yet?
I think it will creep in where it was obvious and I was going to say most relevant, but in a general term, we think, again, we sort of focus on the hazard and the solution, not so much the workers themselves in that sense that you're thinking.
I think in my case, the firefighter research I talked to you about, it's very participatory research from the outset. And in fact, the research began by firefighters approaching me rather than me approaching firefighters. So that's a good way to have a very participatory research program. And we've been very focused on having them drive the research questions. But the example I gave of the qualitative study that we started off with female firefighters, when we started off, it's probably one of the smallest qualitative studies ever published. There were only 4 female firefighters in the study because there were only 5 female firefighters altogether to study. And so, and when we did the work, it was very sensitive. The females did not want to be interviewed at the fire station. They did not want people to know they were participating in the study. The men were a little bit like, "Why are you doing this?" And it was it was interesting over the course of doing the study, and then as now there's more female firefighters in the province, and it's starting to become more aware, and they do have a higher rate of injury. And as they started to recognize that there was a higher rate of injury, they became more interested in the findings. And so by the time we published them, because research work happens much slower than firefighters would ever imagine, they were really proud of the fact that they had participated in this research in a really early stage and were advocating to other people about the importance of considering gender. And it actually toned down a lot of the gender, not talking about gender except under your breath to your same gender things. It actually brought it out into more open discussions. They were very open to going on to the bigger studies about looking at physiological differences in gender, which never would have happened in the beginning because going to that right away would not have been possible. So it really started to bring gender into what they were thinking about, allow them to have conversation about it, to talk about maybe training has to be different for males and female firefighters. So it was really nice to see that evolution. And I think it all happened because we didn't push the issue. We let them drag us instead of pushing them.
In terms of policy, there's a fair amount of work on the impacts of maternity and paternity leave policies. And particularly in Europe, where there are designated days or weeks for fathers that are not part of a shared parental leave. So more like we have in Quebec, where there is a designated pot and a designated capacity for fathers to take leave that's not shared. And where that kind of separate policy exists, we see a much higher uptake of fathers taking leave. And when it's been brought in there, it's a cultural lag, but we do gradually see more workplaces accepting the idea that, oh yeah, fathers can take paternity leave too. Right now, the most recent study I've seen that was done out of U of T suggested that outside of Quebec, fathers who are requesting paternity leave in the workplace are experiencing quite a bit of backlash and stigma. So we know that for women, there can be stigma coming back to work too soon, like you're not a good mother. But if we honor and encourage father involvement, then we need to bite the bullet on how fathers are experiencing requests to take more flexible work options or to be more engaged with their young children.